Ever wondered what your baby is trying to tell you? Babies may not use words, but their tiny gestures, facial expressions, and movements speak volumes. In this video, we'll break down the secret meanings behind their body language so you can understand your little one better. Stick around to the end because number 9 is a signal that every parent needs to recognize. Newborns naturally keep their hands in a fist for the first few weeks of life. But if their fists remain tightly clenched and are accompanied by fussiness or crying, it could be a sign that they are hungry or feeling overstimulated. Babies have a strong grasp reflex at birth, which causes them to curl their fingers automatically, but this reflex gradually fades as they grow. However, if they are clenching their fists beyond the newborn stage or doing so in a tense manner, it may indicate discomfort, frustration, or the need for attention. Observing their other cues, such as sucking motions or rooting behavior, can help determine if they need to be fed. If hunger isn't the issue, providing a calm environment and gentle soothing techniques may help relax them. Clenched fists for a long time. While it's normal for babies to clench their fists during the first few months of life, consistently keeping them tightly shut beyond this period could be a sign of tension, discomfort, or even developmental delays. If a baby's fists remain clenched for extended periods, especially when they seem unsettled, it may indicate stress, fatigue, or a need to stretch their muscles. Some babies also clench their fists when experiencing pain, such as gas or digestive discomfort. Over time, as their motor skills develop, their hands should naturally relax more often. Parents can help by gently massaging their hands or encouraging them to grasp and release objects to strengthen their fine motor control. Open hands, relaxed fingers. When a baby's hands are open and their fingers are relaxed, it is a strong indicator that they are feeling safe, secure, and content. Babies naturally transition from clenched fists to more open hands as they grow and become more comfortable with their surroundings. Open hands are often seen when a baby is well-fed, rested, and feeling at ease. This relaxed state allows them to explore their environment, reach for objects, and interact more freely. Parents may notice that when a baby is deeply engaged in play or bonding time, their hands remain open, showing that they are enjoying the moment without stress or discomfort. Rubbing eyes or ears. Babies rubbing their eyes is one of the most common signs of tiredness, signaling that they are ready for a nap or bedtime. However, if they frequently rub their ears along with their eyes, it could indicate something more than just sleepiness. Rubbing or pulling at the ears can sometimes be a sign of teething discomfort, as the pain from teething can radiate to the ears and jaw. In some cases, excessive ear rubbing might suggest an ear infection, especially if accompanied by fussiness, fever, or difficulty sleeping. Paying attention to other symptoms can help determine whether the baby simply needs rest or if a visit to the doctor is necessary. Quick pause. Need a safe and tested product for your child so you don't have to test it yourself? Well, congratulations. I've handpicked the best on Amazon. Check the link in the description. Kicking legs quickly. A baby kicking their legs rapidly is usually a sign of excitement, joy, or eagerness to engage with their surroundings. When interacting with parents, listening to music, or playing with toys, babies often kick their legs as a way of expressing happiness. However, if the kicking becomes excessive or is paired with fussiness, it could indicate overstimulation. Babies take in a lot of new information daily, and when they become overwhelmed, they may release built-up energy by kicking repeatedly. If a baby seems overstimulated, moving them to a calmer environment or offering a gentle cuddle can help them settle down. Pulling knees to chest. When a baby pulls their knees up to their chest, it is often a sign of gas, tummy discomfort, or colic. This movement is a natural response to digestive distress, as it helps to relieve pressure in their tiny abdomen. Babies with gas pain may also cry, squirm, or have difficulty passing gas. Gentle tummy rubs, bicycle leg movements, or burping them after feeding can provide relief. If the discomfort persists or is accompanied by prolonged crying, a pediatrician can help determine if there are underlying issues like reflux or food sensitivities. The Moro reflex, also known as the startle reflex, causes babies to suddenly stretch out their arms and legs in response to a sudden noise, movement, or change in position. This reflex is completely normal in newborns and is a sign of a developing nervous system. The startle reflex can sometimes wake a baby from sleep, making them fussy or startled. Swaddling can help keep them feeling secure and reduce sudden movements. As babies grow, this reflex naturally fades, usually disappearing by around 4 to 6 months of age. Arching back. Babies arching their backs can be a response to discomfort, frustration, or even medical conditions such as reflux. If a baby arches their back frequently after feeding, it could be a sign of acid reflux, where stomach contents flow back into the esophagus, causing irritation. Arching the back while crying might also indicate frustration or overstimulation. In some cases, babies with colic or digestive issues may exhibit this behavior more often. If back arching is persistent, consulting a pediatrician can help rule out medical concerns. Turning head away. When a baby turns their head away during playtime, feeding, or social interaction, it is often a sign that they are feeling overstimulated and need a break. Babies can only process so much stimulation at once, and when they've had enough, they may look away to self-regulate. This behavior is particularly common in younger infants who are still adjusting to their environment. If a baby repeatedly turns their head away, reducing noise and distractions, or giving them a moment of quiet time can help them regain comfort. Reaching out arms. Babies reaching their arms out towards someone is one of the earliest ways they express their desire for comfort, affection, or to be picked up. This behavior typically develops around 4 to 6 months as they begin to understand that their caregivers can respond to their needs. When a baby stretches their arms toward a familiar person, it shows they recognize and trust them. Responding to this cue by picking them up or offering reassurance helps build a strong emotional bond between baby and caregiver. Flailing arms. When a baby suddenly flails their arms, it can be a sign of excitement, surprise, or the Moro reflex. This reflex, which is present from birth, causes babies to extend their arms outward before quickly bringing them back in, often in response to sudden noises or movements. While this is a normal part of their development, frequent arm flailing can sometimes mean they are overstimulated or trying to release pent-up energy. If the movement happens often during sleep, swaddling may help them feel more secure. Over time, as their nervous system matures, the reflex will fade and their arm movements will become more controlled. Sucking on hands. Babies sucking on their hands is a natural behavior that can mean a variety of things, depending on their age and situation. Newborns often do this as a self-soothing technique, while slightly older babies may be exploring their hands for the first time. Around 3 to 4 months old, babies might begin sucking on their fingers or fists more frequently as a sign of teething discomfort. However, if a baby is constantly sucking their hands and seems fussy, it may indicate hunger. Paying attention to other hunger cues, such as rooting or fussing, can help determine whether they need to be fed. Wrinkling forehead. When a baby wrinkles their forehead, it can signal curiosity, confusion, or mild discomfort. This expression often appears when they are processing new information, such as seeing a new face, hearing an unfamiliar sound, or experiencing a new sensation. Some babies also wrinkle their foreheads when they are about to cry, or if they are feeling gassy. If the wrinkling is paired with squirming or fussiness, gently rubbing their belly or offering a soothing voice can help calm them down. Over time, as they develop better control over their facial expressions, this response may become less frequent. Stiffening their body. If a baby suddenly stiffens their body, it can be due to excitement, frustration, or discomfort. Some babies stiffen up when they are happy and eager, such as when they see a familiar face or favorite toy. However, if the stiffening is paired with arching the back and crying, it might indicate gas pain, reflux, or sensory overload. If the behavior happens frequently and seems extreme, a doctor can help determine if there are underlying medical issues. Parents can try calming techniques like swaddling, gentle rocking, or tummy time to help ease tension. Quick pause. If you're finding this useful, tap that subscribe button so when we upload our next video, YouTube will recommend it to you. A scrunched-up face is often an early sign that a baby is about to cry. This expression can indicate discomfort, frustration, or overstimulation. Babies also scrunch their faces when they experience new or strong smells, tastes, or sensations. If they are scrunching their face while eating, they may not like the taste of a new food or be adjusting to different textures. If they do it while awake but not fussing, they may simply be experimenting with facial movements. Watching for other signs, such as clenched fists or flailing arms, can help parents figure out what their baby needs. Babies bob their heads for various reasons, depending on their age and stage of development. Newborns have weak neck muscles and may bob their heads as they work on strengthening them. As they get older, head bobbing may be a way to self-soothe, especially if they do it rhythmically before falling asleep. Some babies also bob their heads when they are excited or trying to engage with someone. However, if the movement is frequent, uncontrollable, or paired with other unusual behaviors, it may be worth checking with a doctor to rule out any underlying concerns. Babies stick out their tongues as a form of exploration, communication, or reflex. The tongue thrust reflex, present from birth, helps prevent choking by pushing foreign objects out of the mouth. This reflex naturally fades around 4 to 6 months as babies get ready for solid foods. Babies also stick out their tongues when they are playing, imitating adults, or experiencing teething discomfort. If a baby frequently sticks out their tongue along with excessive drooling, it may be a sign that they are about to start teething. Shivering or trembling. Occasional shivering or trembling in newborns is normal and usually due to their developing nervous system. Babies' muscles are still learning how to coordinate movements and their body is adjusting to temperature changes. However, frequent or intense shivering, especially when the baby is not cold, may indicate low blood sugar or a neurological issue. If a baby shivers often and seems weak or unresponsive, consulting a pediatrician is a good idea. In most cases, though, mild trembling in newborns resolves on its own within the first few months of life. Kicking one leg more than the other. If a baby kicks one leg more than the other, it is often just a natural preference or part of their early motor development. Babies tend to explore their bodies in different ways, and it is not uncommon for them to favor one side when moving, especially before they gain full control over their limbs. As they grow, their ability to coordinate both legs improves, and they typically begin to kick more evenly. This process is an important part of building muscle strength, refining their motor skills, and preparing for milestones like rolling over, crawling, and eventually walking. However, if a baby consistently favors one leg over an extended period, it may be worth observing more closely. If the movement appears noticeably uneven and is accompanied by stiffness, weakness, or discomfort, it could be a sign of an underlying issue such as muscle tightness, hip asymmetry, or a neurological condition that affects motor function. In rare cases, persistent one-sided movement could be linked to conditions like hip dysplasia or mild cerebral palsy, which may require early intervention to ensure proper development. To help a baby develop balanced muscle control, parents can encourage equal movement through activities such as tummy time, gentle stretching, and interactive play. Placing toys on different sides during playtime can motivate them to move both legs equally, while activities like baby massage and bicycle kicks can promote flexibility and coordination. Opening and closing mouth repeatedly. Babies often open and close their mouths repeatedly for a variety of reasons, and this behavior can change as they grow. In newborns, this motion is frequently associated with hunger and is part of their natural rooting reflex, which helps them instinctively turn their head and latch onto a bottle or breast for feeding. This reflex is crucial in the early weeks of life, ensuring that babies can nurse effectively. As they get older, however, they may begin opening and closing their mouths simply as a way to explore their own facial movements and strengthen their oral muscles. This newfound control is an important part of their developmental process, as it helps prepare them for more advanced skills like eating solid foods and even early speech. Another common reason babies exhibit this behavior is teething. When their gums become sore or itchy due to emerging teeth, they might repeatedly open and close their mouths in an attempt to relieve discomfort. This movement is often accompanied by drooling, increased chewing on objects, and general fussiness. Offering a chilled teething toy, a clean finger to chew on, or a pacifier can help soothe their irritation. Some babies also mimic adult behaviors, and if they see parents or caregivers talking, chewing, or even making exaggerated mouth movements, they may try to imitate these actions as part of their learning process. While this behavior is usually harmless and temporary, parents should observe for any signs of distress. If the repetitive mouth opening and closing seem excessive, occur alongside discomfort, or appear to interfere with feeding, it may indicate an issue such as oral irritation, thrush, or even a mild tongue tie affecting their ability to nurse or bottle feed properly. If concerns arise, consulting a pediatrician or pediatric dentist can help determine whether any intervention is needed.